What can physicians operating in a Title X clinic do under the 2000 regulations that they could no longer do under the Protect Life rule? I think that's the heart of the matter here.
There is nothing that physicians, healthcare providers, nothing that they cannot do except refer for abortion.
For family planning purposes?
For family planning purposes. No, for family planning purposes. They are permitted to refer for abortion in the case of medical situation or in the case of rape or incest. Okay. However, for family planning services, the prohibition against referral for abortion as a method of family planning.
And is it your position that the underlying statute already precludes that?
Yes.
So why did HHS make these changes? What you were asked earlier and didn't really have a chance to respond in depth. Was there any evidence of misuse of program dollars?
The Secretary felt that there was significant opportunity for commingling of funds when there was co-location of family planning provided services in a same location where abortion was provided. There was opportunity for commingling of funds. He also went on to state that if, by being co-located, a Title X provider was able to benefit from economy of scale, fungibility of funds in any way, that also would be in violation with Section 1008, which required that these funds may not be used in a program where abortion is a method of family planning. And based on his opinion, based on the opinion of the Supreme Court, finding that, again, this was a reasonable interpretation, they also found those regulations to be completely clear from any violation, statutory or constitutional, as a result of that.
Okay. Some community health centers are concerned the changes Title X will interfere with the patient-provider relationship by limiting providers' ability to give their patients comprehensive information, even when the patient directly asks for that specific information. So my question is, once the Protect Life rule is fully implemented, is there any information that a physician operating in a Title X clinic will no longer be able to share with his or her patient?
There is not.
None?
No, they are completely free in a non-directive way, which is mandated by Congress, that any counseling must be non-directive. However, they are not prohibited from having full conversations, answering those questions that their clients have.
So if a client came in and they had a child that they were expecting that had determined to have a medical problem that could be fatal, could that doctor say, here are your options? You could terminate the pregnancy today, you could do compassionate care, or you might do some extraordinary activity after birth?
Yes, they are free to provide counseling on all of the options, including the options of abortion for their client.
Okay. Now, as I mentioned earlier, my district is, well, it's bigger than any state east of Mississippi, so getting access to care for Oregonians is really essential in these very rural, underserved areas. We have 3 counties with no doctors and hospitals, hundreds of miles in between. So talk to me, given your experience as a pediatrician, as somebody who's served in these sorts of areas, are the changes in the rules going to adversely affect my constituents' ability to access reproductive health services and health care in these community health centers?
One of the other changes in this regulation and rule is to encourage grantees to apply who have shown innovative ways to address services for those particularly in unserved or underserved areas, particularly rural areas. And we are hopeful that there will be grantees that will provide those services that currently are not being provided in some areas.
Because I understand under perhaps the existing contract grant application process, one of the criteria is to look at total number of people served. And as I say, I've got counties with less than 2,000 people and hundreds and hundreds and hundreds of square miles. And it seems to me under the current rules they could be excluded.
Again, those criteria are not exclusionary. It is one of the factors that we look at to determine who provides the best coverage for a broad range. Those are not exclusionary. However, I agree with you that if there is increased rural coverage, there may be a decrease in the total number of patients serviced. However, the opinion of the department is that in urban areas, there are other access areas for them.